Welcome back to our class in microbiology. And today we are going to discuss the basics on infection. Your topical infection is actually subdivided into two. We have part one and part two. But for this meeting, we are going to discuss only the part one. So for the first topic, we are going to discuss the host microbe infection. So I think you know that the host is the one that carries the microorganism or the recipient of the microorganism. So the microbe, we are referring to here the microorganism that could either be pathogen or non-pathogen. But in our topic, since we are discussing about infection, we are referring to the microbes that are pathogenic in nature. So the host microbe relationship is actually looking into how where the host and the microorganism are actually involved with. Another topic that we're going to discuss is the type of infection based on their occurrence. And then the type of infection based also on distribution in the host will be discussed. And in order to understand further this distribution and occurrences, we have to discuss the how infection takes place by understanding the different essential steps for infection, as well as the cases for infectious diseases, not on the individual but also on the community. Okay, this is just a plus view on our previous discussion as to the different types of microorganism according to how they carry microorganism or the presence of microorganism that carries diseases or not. So we have the pathogenic or the pathogens, or commonly known to the layman as germs, as the disease-causing microorganisms. As for the non-pathogens, these are the microorganisms that are not directly involved in the presence of infection. Still some concepts on the microorganism. Uh, However, there are non-pathogenic that could lead to the formation of food, but there are also some pathogenic that are present in food. And usually these foodborne microorganisms are usually the cause of gastrointestinal diseases, which symptoms are diarrhea. And then also likewise the non-pathogens contributes in the healthy condition of our agricultural needs like healthy soil. However, also again, there are some microorganisms or pathogenic microorganisms that we could derive from soil or just simply gardening. And then while there are some microorganisms that aids in the decomposition of organic waste, especially in the big ocean, there are also some diseases that we could get from water. Okay, some are, as I have mentioned, there are even some pathogenic microorganisms that we consider it as disease-causing, just like the case of Escherichia coli. However, the E. coli found in the large intestine are beneficial, especially in the since it is a part of the natural flora. And also likewise, the E. coli is part of or present in our urinary system. Okay, again, still a review. We have discussed before that these are the things that are needed by microorganisms in order to grow. You have the temperature, you have the pH, and also likewise the intensity of light, and then the nutrients or the food present, and then moisture or the water content availability, and then oxygen. Still on the review about oxygen, there are actually some microorganisms that we consider as aerobes, and we have also the anaerobic. And the difference of the two is for the aerobes, there is a presence of oxygen, but in the case of anaerobic, the microorganisms do not grow with the presence of oxygen. So the oxygen-loving animals are the aerobes or the anaerobic microbes, whereas those that do not grow best in oxygen are called the anaerobes. Okay, let's go now to our proper discussion. What is infection? So infection is the lodgement or the entry and as well as the multiplication of microorganisms in the tissue of the host. And usually the hosts are animals or even the plants. So do not put into your mind that infection is only caused by uh, or is present only in animals but also likewise in plants. Actually, the first virus that was discovered was found in tobacco. It is called the tobacco mosaic virus. So you could see here microcolonies as shown in the microscope um, present as a film. Although these are not individual microorganisms, but they are group of microorganisms. And then these are already individual microorganisms and they are clustered together and they are found already in the tissue of the host. In a more magnified view, they could invade the tissue in this manner. Although you can see also uh, some group of organisms already growing. So infection is there if there is enough microorganism to cause the disease or infection. Because there are some instances that while the microorganism had entered into the skin, immediate washing could also remove the action for further infection. Okay, what are the types of infection? As you can see here, um, you have some illustration as to local infection. If we say local infection, they are only found in a specific portion. So as illustrated in the picture, the infection could only be found on top of the knee or on the skin of the patient or the individual. So for human, usually the symptoms that could be felt if there is already infection is the presence of pain, redness, and also the sensation of heat, uh, and then the swelling in extreme cases or in some cases, the presence of pus, and then in the other cases, foul smelling drainage. So parang may ibang amoy na. So parang yung una is there should be pain, it should be felt, the color should be there, it is redness or it is or in some cases violet or black already, and then the heat of the side. Uh, while it is true that it might be only the wound or the bite might only be a small one, but and the redness also could be in a certain perimeter, but there is even a bigger perimeter for the presence of heat. So these are the common symptoms of infection at a local level. Although we have also systemic infection. Systemic infection, ibig sabihin yan, it means that um, the infection had already spread uh, to a bigger portion or it had infected a certain system of the body. So usually the common symptom is, of course, fever, aches, or pain. and then chills or even nausea, vomiting, and of course, weakness. So these are the systemic infection. So at this point, I would like you to differentiate how you feel if you were only being wounded, and then what you feel when you have flu. The influenza is caused by influenza virus. It actually infect the body in a systemic way. So usually these are the symptoms that we feel in the presence of influenza. But in the case of infection or just simply a wound or a bite, animal bite, um, these are the common things that we feel. And then the classification of infections comes in many ways. Uh, we have the primary infection, reinfection, superinfection, secondary infection. This is one group of classifying infection. So if we say primary infection, it refers to the initial infection of the organism in the host. It is actually the time that the microorganism or microorganisms penetrate or enter into the tissue or to the specific part where infection will come in. It could be just simply via skin abrasion or it could be respiratory, just like our COVID virus. The primary infection here is actually the, the exposure to, to the virus. And then we have also reinfection, the subsequent infection by same organism in a host. So, for example, the person had a flu and then later on gumali siya and then nagkasakit uli siya, then influenza virus came in, and then some opportunistic bacteria also come in, then even after recovery, there is infection. So that is what we call reinfection. So parang binisita mo uli yung microorganism. And then for superinfection, uh, it is an infection by same organism in a host before recovery. So, ito yung, or this is the one that we are telling na we are not yet fully recovered, and then here comes again the the higher intensity of infection. So maybe this is caused by negligence of the host or failure of the host to take in medicine or failure of the host to clean the infected wound if it is a wound. And then you have also secondary infection. This happens when in a host, whole resistance is lowered by pre-existing diseases. So, um, for example, the person is suffering from influenza, and then here comes the opportunistic Mycobacterium tuberculosis. So instead of just simply plain flu from time to time, uh, another microorganism comes in. So that is what you call secondary infection. Or it might just be a simple wound with ordinary bacteria from the soil infecting the skin. And then here comes the entry of Clostridium tetani, or this could be taken from playing with the dirty soil or dirty playing objects by children carrying that microorganism. The next type of classification or next group classification of infection includes the focal infection, cross infection, nosocomial nosocomial infection and subclinical infection and opportunistic infection. So what are the differences of these things? Okay, for focal infection, it is a condition where the infection at localized sites like appendix, tonsil are actually affected. So there is a focus. There is a certain part of the body that is only infected. So like for tonsillitis, if the person is suffering from tonsillitis, what is infected here is just simply the tonsil. But if, for example, in the tonsillitis, um, it is the microorganism treated or was already overcome by the patient, it does not mean that the other infection are already treated. So, if for example the person is suffering from tonsillitis, and then at the same time the person has an infected wound, it does not mean that if the person had already overcome the tonsillitis, the wound is already treated. So the one that is infected also requires another treatment because that is another focus of infection. Okay, so another kind of infection is cross infection. That is when a patient suffering from a disease and new infection, it is set up from another cause or external infection. So uh, here it means that the patient is suffering already from a disease. And then a new type of microorganism is welcomed by that patient or had entered into the system of the patient by another cause. So, for example, the person is suffering from influenza. May I focus on influenza because I'm sure you are all familiar with influenza. So, for example, if the person is suffering from influenza, and then all of a sudden, he was visited or she was visited by uh, a friend who is a carrier also of COVID-19. Tendencies is the the patient will also get the virus COVID-19. So that is cross infection. So the microorganism is taken from the outside while the person is also infected. And then we have also nosocomial infection. It is a close infection occurring in the hospital. So this is the danger in the cases of not proper hygiene or not practicing proper hygiene among the medical workers also. This nosocomial infection happened during the past years, whereby the patients are exposed with nurses who do not practice then hand washing or even changing of lab gowns. And actually, this is a practice that the practice of not bringing out lab gown is actually related to nosocomial infection because the dresses, a simple gloves, a simple gloves contaminated with microorganism could also be a form of or is an object that could carry a microorganism. So you just simply try to imagine the nurse coming from a ward or from a room na merong sakit na COVID. Tapos hindi pa nila alam noon na may microorganism na COVID. So, since na-expose siya sa COVID, tapos pumunta ulit siya sa ibang pasyente to get the temperature, edi siyempre malapit yun sa ano, yung pagbigay ng thermometer. It is very near to the patient. The contact of the patient and the nurse is very short, no, the distance. So you could see here how a nurse could contribute to infection. Not only maybe infection, but also likewise in laboratory rooms na hindi properly attended to. But the DOH is, or the Department of Health, is very strict with the possible occurrence of nosocomial infection. Yung paggamit ng UV light radiation before and after a patient is admitted to a certain private room or to a ward, yun, mga practices to prevent also nosocomial infection. Yung palagi ang pagpalit ng lab gown, and also likewise yung mask is also one way, many ways of preventing nosocomial infection. And then we have the subclinical infection. It is one where clinical effects or clinical analysis effects are not apparent. So uh, the infection could not be seen, but the infection is there. And then we have also opportunistic infection. Uh, these are the microorganisms that are really opportunistic. The name opportunistic is really applicable because these opportunistic microorganisms enters during the period when the body of the individual or the immune system of the individual is also very weak. Okay, another classification or group of classifying infection is endogenous and exogenous. Endo means inside, exo means outside. So if the infection is outside the body, then it is exogenous. But if it is inside the body, like tumor, metabolic disorders, these are endogenous infection. Our next topic is understanding the infection and infectious process. So first we are going to trace the sources of infection in men. The causative agents for infection refers to what causes the disease, or the causative agent might be a pathogenic microorganism present in a certain area that might not be able to multiply or may even multiply, causing severe kind of infection. So we have the saprophytes. They are free living organisms, but they fail to multiply on living tissue, so they do not usually cause adverse effect that could endanger the life or health of an individual. And then we have the parasites. They are also organisms that can establish themselves but able to multiply within the host. So they might be disease causing, or they might just be there using the host in order to reproduce. Pathogens are those which are capable of producing within the host. On contrary, commensal microbes can live without causing any disease. So within the infection, there could be two probable microorganisms present. One could multiply, the other one could also multiply, but the other one causes disease, but the other one is just simply there, reproducing without causing any trouble or causing any disease to the individual host. Or we have now to discuss the sources of infection in man. So your mind setting for this time is to look at man or yourself as the subject for infection. But think of another man, not yourself, as the one having the infection. Okay, man is actually the most popular and the most common source of infection for a patient. So there are so many diseases that were actually taken by man from another man also. The reason maybe is the characteristics or the nature of a man as a host are the same as compared with a dog or a pig to a man. So the physiological properties or nature of a pig is actually different from man. But a man, for sure, has the same physiological properties that uh, a certain microorganism is staying from one person to another. A healthy carrier is a person harboring a pathogenic organism without causing any disease to him. So you yourself have actually microorganism within you. Actually, there is no clean or there is no man that is negative with microorganism. It is alright. It is a rare case for a man that do not harbor any microorganism. Although we have what we call the bubble man, in which just a simple exposure to a simple microorganism could lead him to severe condition. But those are rare cases. And then another type of carrier is the convalescent carrier, the one who has recovered from disease but continues to harbor the pathogen in his body. So we have the healthy carrier, we have the convalescent carrier, or just simply convalescents. We refer them as convalescents. So a healthy carrier harbors a pathogenic organism without any symptoms or without any disease uh, to him or symptoms of a disease present. And then we have also the convalescent. He carries the disease, he carries the microorganism, but was able to recover from it. But even though the person had recovered from it, he he continues to harbor the pathogenic in his body. There are some microorganisms present in the gastrointestinal tract. They they could not be removed from our body naturally, but there are some instances that the symptom diarrhea could be felt, but there will be also some time that microorganism will not do any action to the body. So as if we call it immune to the body. Um, the process of infecting an animal from man is what we call anthroponosis. So pag yung tao yung nag-cause ng microorganism, we call it anthroponosis. Another source of infection are animals. So the infectious diseases transmitted from animals to man is called zoonosis. So zoonosis may be bacterial. It could be caused also by the ricochet group, the virus, the protozoans, and even the helminths. Um, and the helminths are usually taken from our pets. and then also fungal infection. So animal and animal-like organisms could be classified as zoonosis as a source of infection. And then another cause of infection is are the insect group. The disease caused by insect groups are the arthropod-borne diseases. So the arthropod. So this includes the organisms, mosquitoes, the fleas, the lice that are transferring or carrying microorganism from them without any symptoms of the disease or without any sign that they possess such kind of microorganisms. But once those microorganisms were given to a man, then there are other possible symptoms that could occur. And we call these animals that carry microorganisms as the vector, or the one that transmit a disease or an infection from one host, and then they carry that taken from that host and bring it to another host. So that is their role as a vector. But if the carrier or the mode of transportation is or the mode of transmission is non-living organism, then we call it mechanical vector. So it is just like using dirty glasses, dirty spoons, or dirty beddings. These are what we call mechanical vectors. But if they are the animal vector, then we call them biological vector. Our country was once visited by a very strong vector or biological vector, that is the Annapolis mosquito. Even during the Japanese period, the Japanese soldiers are afraid or do not invade a certain household if somebody is suffering from uh, malaria. But there is actually one interesting topic related to Annapolis mosquito, because there is a tribe somewhere in the Cagayan that is that are the members of the tribe are actually resistant to malaria, even though the scientists have found out that most of the mosquitoes present there are Anopheles mosquito. The case of malaria, sorry, malaria is zero. And then we have also some vectors that are biological, but they also are classified as reservoir hosts. So they are carrying the poison, they are carrying the microorganism, but there are some instances that their entry or their bites do not give off readily the microorganism, not just like the mosquito. There are some ticks uh, that gives a bite but do not uh, lead to fever. But there are also some bites of ticks that will lead to fever, just like the case of relapsing fever and spotted fever. And then, of course, you have also the soil or the dust, and usually these are carrying spore-forming microorganism like spores of tetanus bacilli, and many bacilli group. The gas gangrene infection present in soil could lead to tetany or tetanus. So you have the Clostridium tetani uh, causing tetanus. And they are not only found in rusty metals, as our parents claim as the source of tetanus, but also likewise in soil. Okay, another source is water, cholera, hepatitis virus. These are the common things that we should usually hear, no? And Vibrio cholera, hepatitis A, hepatitis B are actually found in water. Even the microorganisms Escherichia coli, they are also found in water. And then we have also contaminated food. Generally, all food are clean, but because of some movements or some processing that are not hygienic in nature, the foods become infected. Okay, what are the methods of transmission of diseases? That is our next topic. Okay, we have direct contact or sexual intercourse as a method of uh, transmitting infection that leads to syphilis, gonorrhea, or other sexually transmitted diseases, including AIDS. And then also likewise by inhalation of air and even dust and even droplets. And that includes influenza, smallpox, mumps, tuberculosis, measles. These are the common uh, airborne cause this infection. Although COVID-19 is still not considered as airborne, COVID-19 could be transmitted through droplets. That's why we are wearing masks. And then we have also inoculation or by bites. The dog inject or inoculate the the saliva that carries the microorganism. So you have the tetanus, that is actually the infection, the microorganism involved, Clostridium tetani, and then we have also rabies from dog, arbovirus from insect. There are different types of diseases related to insect, and then you have hepatitis. And then you have also ingestion through water, food, and even playing with or licking some parts of the body like eyes, like the fingers. That's why we usually scold the or give warning to children who are actually playing with their fingers or they do thumb sucking. Okay, another is the iatrogenic or laboratory infection. This could be due to malpractice or the use of unhygienic apparatus or equipments. And then you have also congenital that was taken during the period of conception or pregnancy in the case of mothers. Okay, we have also the vectors as the carrier of microorganism like the flies and the mosquito. We have discussed that last time. And then what are the characters of pathogens? This is a very interesting topic. Okay. When do we call that such organism is pathogen entering to the body or causing a disease or infection? The bacteria should be able to enter the body. The organism should be able to multiply in the tissue. They should be able to damage the tissue. They must be capable to resist the host defense. Okay, let us take this one by one. So if the bacteria is just simply around your surroundings, and was not able to enter to the skin or to the respiratory system or to the gastrointestinal tract, or they were not able to penetrate the body of the host, there is no infection. So the bacteria should have a contact with the body in order to have an infection. Another, although there is the microorganism already on the skin or any part of the body, but if they had not met the desired level in order to produce a symptom or a disease, then you could still wash that off with water and infection will not come in before they were able to multiply to damage the tissue. Okay. Another is what I have just made mention. The number or load of microorganism is actually the one that could lead to damage the tissue. It is not necessarily the stronger they are, the more intense is the infection. In terms of microorganism, their power is actually on numbers. Although you have 5 bacteria, they're very healthy, but their number or their load is not yet enough to damage the tissue, then there is no infection that would occur. But even though you have the not so healthy pathogens, but their load is too many or too big, they could be capable to destroy or damage the tissue. Since their size or their number is too big enough that the host could not withstand and fight using his or her immune system. Okay? Now, there are so many things that you should learn about infection. Another is the difference between pathogenicity and virulence. Okay. Uh, some medical words that are related to microbiology. Pathogenicity, that is the ability to cause a disease or to produce a disease, from the word pathogens, to produce a disease. Now we have also virulence. This COVID-19 period, maybe you were able to hear 1,000 times or 1,000,000 times already the word virulence. Virulence is referred to the ability of microbial strain to produce a disease. So we are looking into a specific kind, a specific strain producing a disease. Like for example, the virulence of COVID-19, na palagi nyo naririnig yun, no? The virulence is very strong. Tipong gano'n na naririnig sa news, on TV, or even in the internet. So some definitions or viewpoints for layman refers pathogenicity as the quality or the state of being pathogenic, or the potential ability to produce a disease. That is pathogenicity. Now, virulence is the disease producing power of a microorganism. So, specific, there is the disease from a specific organism. Okay? Pathogenicity is measured as all or none, or positive or negative. The pathogenicity is zero. The pathogenicity is very strong. The virulence is a term that measures the strength of a certain pathogenic microorganism. Okay. This is another term also to, to differentiate infection to virulence. So, virulence, as we have made mention, is measured by the severity of the disease caused by an infection. Infectivity is the ability of an infectious agent to pass from a sick person to a healthy person. So, yung virulence, as we have made mention, specific disease, the extent of the severity of a specific microorganism. Now, infectivity, the definition of such is the capability of the pathogenic organism to transfer the disease from one host to another. Now you have determination as one way to differentiate these two. In virulence, we are measuring the affected animal or host by LD50 or ED50. So it is measuring the dose causing the disease, that is for ED50, or the dose that is needed to kill the host. Now, with infectivity, it is the proportion of the individuals that develop the infection and all susceptible individuals who have been exposed to the infection. So what they are measuring is actually the number of capable or probable patient within a certain community. Now, what is the importance of knowing the virulence? It determines how severe will be the disease. So it uh, presents a certain trend or prediction. Infectivity, the extent how this could be transferred to man. Okay, let's go specific to virulence. What are the factors of virulence? There should be adhesion. There should be an entry. There should be a point of entry because adhesion is the initial event in the pathogenesis of many infections. Is the attachment of the bacteria to the body surface or a microorganism to a body surface. This attachment is a specific reaction between, take note, surface receptor and adhesive structure on the surface of the bacteria. And that is what you call the adhesin. This is actually the bacteria looking for the specific receptor site, yung specific na lugar kung saan siya maglalanding. Parang aeroplano rin. Meron siya dapat airport. So, kung walang airport na posible niyang uh, port of landing, hindi makakapag-landing yung aeroplano. The same true with microorganism. If there is no specific surface receptor, the adhesin of a bacteria would never adhere to the host. Okay? This is some illustration as to how the bacteria adheres to a certain tissue. So, unahin natin, let us start with this drawing, animated drawing or illustration. So, you have here the microbes or the pathogenic microorganism. The green one are actually the adhesin. So this is still a part of the microorganism. This is the one that is looking for where the airport is. And then this portion here are actually your external part of the skin. If you are familiar still with your biochem, these are simple uh, molecular structure. They could be lipids or a series of fatty acids. So this violet here is your receptor site. So ito yung hahanapin ngayon ni adhesin. So the adhesin will be looking for these things. These are the favorite sites of the, the microbe. Okay. Once the microbe had found its on receptor site, or once the ligand had binded to the receptors or surface receptors of the cell, just like here, you have here the bacteria, the E. coli, the green in color, on the human bladder. So this is a man tissue. And then you have also here bacteria adhering to human skin. So you have here the exact illustration. Of course, this one, they are still looking for the receptor site. But this one, they have already found its receptor site. So there is already the initial stage, the adherence of the bacteria. Another factor of virulence is the invasiveness. It is the ability of the microorganism to invade, from the word invade, no? So you have the localized lesion, dun lang sila. So focal yung infection. Or it could be generalized. They have taken from tip to toe of man. And that is usually through the bones, through the veins, or through the blood. And the generalized infection through the blood is usually called septicemia. And then you have also toxigenicity. So it could be classified either exotoxin or endotoxin. And then about na-discuss na natin yan. Another is communicability, coagulase. Another factor is fibrinolysine, and then hyaluronidase, and then you have the leukocidins, and then you have, of course, the IgA1 protease and hemolysin. The presence of these things actually affects the virulence of a certain infection. So these are commonly tissue and blood related, yung mga factors na yan. Okay, these are actually arts in microbiology. This is actually a petri dish with blood agar, and the microorganisms are this one. You have the microorganisms here. So do not be amazed, because these are microorganisms that are susceptible to cause disease. And then these are the factors that affects the virulence of microorganism. Number one is, of course, the bacterial appendages, because these are the ones responsible in looking for where to land or to determine the receptor site. This is an example of capsulated bacteria. Capsulated bacteria like pneumococcus and Klebsiella pneumonia and even Haemophilus influenza stands phagocytosis. So we have also the infecting dose, referring to the minimum infection dose or MID, or you have also the minimum lethal dose, or the capability of the microorganism to produce the desired skin or the desired volume or population in order to infect skin or a part of a body. Another is the route of infection. Let us start to take the case of Vibrio cholera. The Vibrio cholera is effective orally, but the Vibrio cholera could not produce cholera if they are only found on your elbow or even in your toes. And then you have also, excuse me guys. Another thing to consider in infection is the type of infectious diseases, whether it is localized or generalized. So I think you can claim that if it is localized, it is just simply easier to settle down or to treat the disease because you are only referring or dealing with a specific site and of course a specific kind of tissue also. But with generalized, the bacteria or the microorganism had circulated nearly in all parts of the body, especially if it involves about the blood, the bones, no? And if bacteria is the one causing the generalized infection, we call it bacteremia. If it is virus, then we call it virusemia. No? So these are illustrations of blood cells, and these are the virus. And in this case, you have the bacteria and you have the red blood cells. And then you have also septicemia, in which the toxin and the organism itself had uh, caused severe condition to the host, especially on the case of on and off presence of fever. And then you have also pyemia. Pyemia is a condition where pyogenic bacteria produce septicemia, but in this case, with multiple abscess in the internal organs like spleen, liver, and kidney. Now, what is the difference here? Septicemia is just simply talking about the blood, the circulation of uninfected blood. But in pyemia, it is septicemia plus infection of another internal organ like spleen, liver, and kidney. In some cases of severe infection of spleen, uh, sometimes the occurrence of cancer could probably be present. And then we have also another type of classifying infectious diseases, which is very popular nowadays. You have the endemic, epidemic, pandemic. When the COVID-19 was not yet around, it is too hard for me to explain what is pandemic or how pandemic could spread through the world. Kasi parang napaka-imposible na yung microbes sa Russia ay pupunta sa Pilipinas, no? And that yung microbes ng Pilipinas ay pupunta ng US, ganun ang kaso. But with the presence of the COVID-19, with your experience in COVID-19, it is very easy for me to explain now what is pandemic. Okay? So I will explain what is pandemic. Natakot tayo ng more than 2 years because of the pandemic, and the pandemic is still with us. And we are hoping that it will go down to epidemic already, no? Since There are so many who are not wearing anymore the face mask, and they are not producing or showing any symptoms of COVID. And then pabaliktad. Let's go to epidemic. Epidemic disease is one of the that spreads rapidly, involving many persons in an area at the same time. So there is a place, but the spread of the disease is very fast, and that spread is taking nearly at the same time. And then we have also endemic. Endemic, present in a particular area, endemic to a place. So dun lang, like typhoid fever is endemic in most parts of India. Tuberculosis is endemic in most parts in the Philippines. Then we have also incubation period as the first stage of infectious disease. And then the second stage is the prodromal period. And then you have the invasive stage. And then you have the decline stage. And then the convalescence stage. Okay, I want you to rewind your knowledge in the graph that you have illustrated in the need for nutrients of microorganism or the stages of life of a bacteria wherein you have the growth curve, no? So yung first stage is also the first stage of the growth curve. That is the incubation period in which you have the microorganism already, but the symptoms are still absent. So you are still claiming that I was not infected. You are still in the denial stage because you could not see that there is a symptom. You could not feel that there is a symptom that is present within you or you are experiencing. And then you have the prodromal. Uh, After the entry or the incubation period, there are already a sensation of headache. There is already a slight fever. From 36, it went to 38, and headache is already there. And the individual might feel already weak and would like to be welcomed by the bed. And then you have the invasive. All the possible symptoms here will come out. And the microorganism is really invasive. So it is called invasive state. So it goes to all the parts of the tissues or of the whole system or of the whole body in order to be able to produce all the symptoms needed in infection, whether it is a local infection or a general infection. And then you have the decline stage. The microorganisms are still there. The immune system might be able to fight, might be able to lower the occurrence of the symptoms, or might even decrease the invasiveness of the microorganism. So you have also the convalescence period. The microorganisms are still there, but the individual or the host cannot feel or experience any symptoms already related to the disease and feels that the condition or his condition is back to normal. So it is just like your growth curve. You have the incubation period going up, and then you have the prodromal that is actually is still increasing in number, and then in the invasive states is still increasing, and then in the decline, it is going down. So the invasiveness is the flat curve whereby there is an equal death and the production of microorganism. Hence, the symptoms are all there and then decline, going back to the death phase. So if the death phase were there or was there, then convalescence period also prevails. Okay, this ends our discussion for infection for this meeting, and then we will continue this lecture uh, for your next lesson, but still on infection. Thank you for bearing with me in discussing the some basics in infection.